global plan has 5 pillars, all of which are almost equally important. From the World Health Organization's perspective, we feel we can particularly contribute to Pillar 4, improving people's behavior by having better legislation in place. We need to improve people's behavior on the road, particularly those that are driving, reduce driving under the influence of alcohol, reduce speeding, etc. Improve seatbelt wearing rate in the front and the back, as well as motorcycle helmet wearing, by communicating around the importance of respecting legislation.
There traditionally has been an approach to dealing with public health issues in the developing the third world, which is responding to problems that have already happened. And what's great about road safety, it's preventing problems before they happen. And it's so much easier and so much less expensive.
Costa Rica has been a pioneering country in road safety. They understand that you have to build a safe system. Safe drivers, safe road users, safe vehicles, and safe road infrastructure. And it's doing all of this together and understanding how the pieces fit that make Costa Rica such an important example to the rest of the world.
So together we carried out a seatbelt campaign that was very successful. We increased the use of seatbelts from around 20% to over 84% in a matter of 8 months.
We are already getting new traffic laws. We are getting some different ways to communicate the problem. We are taking care of the education system, but we are doing more than talking. Now we are showing strategies and new ideas in order to go against these traffic problems.
We've had so many countries from Africa, from India, from South Asia, Latin America that are all crying out for an initiative like this. I think it proves how badly this is needed. And I think Vietnam was always at the cutting edge, and it was where the rapid modernization and motorization was resulting in this explosion of motorbikes. And I think, as we've always predicted, that was the beginning, and now it's spreading out. Here in Cambodia, it's no different. This was a very, very poor country, as we all know. But you can see with all of the cars, but especially the motorbikes, as people are getting better jobs, they're able to afford better transportation. They've gone from walking to bicycles, and now in particular into the motorbike. We think the helmets, especially in this part of the world, are a really easy intervention that can have immediate impact. So that's why we're focusing on this.
So what happens if you see?
The Road Safety Fund is a brilliant way to help us directly here in our work and support and save children's lives. So the children here have received helmets. This is a fairly poor school. The family income is about $100. So obviously making an investment for them of $30 if they have 3 kids to buy 3 helmets is almost impossible. So we're very happy that with the funding and the help from the corporate sector, the Road Safety Fund actually helps us to save these children's lives.
The police that attend these crashes and deal with the emotional trauma know that if the crash hadn't happened at speed, if the driver hadn't been drinking, if the driver hadn't been distracted, if the occupants of the vehicle had been wearing seatbelt restraints, if the motorcyclist and the children on the motorcycle had their brain protected with quality helmets, the consequences could have been vastly different. There would have been injuries possibly, but not the deaths. So those are common features, and it doesn't matter if you sit down with police officers from one continent or another, one country or another, the conversation is a common conversation. The desire to actually do things differently and apply what we know works. That's the thing, there's this body of knowledge around policing. We know what works to stop these accidents.
El objetivo principal de este programa es bueno, sacar de la circulación a las personas que vienen conduciendo bajo el influjo del alcohol. Es muy importante porque evitamos muchos accidentes. Sí platicamos mucho con la gente, le hacemos ver que es un programa que les está ayudando, que no les está perjudicando, sino les está ayudando.
What I like about private philanthropy is you can focus your efforts where the science says you get results. You know, you go after the low-hanging fruits, you can make an enormous difference right away. If you could bring the traffic death rate down, probably 50, 60, 70%, it's a solvable problem. If people were to wear seatbelts in their cars, wear helmets when they are driving a bicycle or a motorcycle or motor scooter, if we were to have some better regulation, keep people from speeding too much and enforce drunk driving laws, you could make an enormous difference in the number of people killed.